want you all to think about the last time you experienced our healthcare system. Was there an emergency? Was it more of a checkup? Were you the patient, or was the patient your kid, your parent, your best friend, your partner? The white coat traditionally is associated with science, purity, cleanliness. In the pharmacy, it's a really great way to identify who's in charge. But I bet when I walked out here, some of you had a little bit of a rush of nerves come over you. It's okay, it's way more common than you might think. We even have a name for it: white coat syndrome. But my goal here tonight is not to scare you. So, while I will be talking to you all about some experiences I've had from working in pharmacy over the last decade, for our time together, Dr. Elliott's off duty, and you'll be hearing from James. A few months ago, I started giving a lot of thought into what I wanted this talk to be about. What was the one thing I wanted to leave you all with tonight? And I started thinking about my daily interactions with patients, how they often expect to hear, "What brings you in today?" That's what we're trained to ask, but I'm starting to think that might not be the right question. Maybe instead we should try, "How are you?" So tonight I'd like to explain why I believe that, but in order to do that, I'd like to go back a little bit. So when you're starting out in healthcare, most of the time there's going to be some kind of interview, and someone's going to ask you, "Why do you want to work in this field?" And I would bet most people would say, "I want to help people." It seems obvious. But how do we do that? Well, we study a lot. Even though a lot of what we're going to learn in school is going to be outdated by the time we graduate. We even take classes where we play pretend just so we can learn how to talk to people. We're also trained to use a lot of open-ended questions, ones that don't have a yes or no answer. So like, "What brings you in today?" The hope is that the patient can then feel empowered to be a part of the conversation and ultimately their care. And the other bonus, and I think what maybe scares a lot of healthcare folks because time is so limited in the clinic, is that an open-ended question has no boundaries. Patients are allowed to say whatever they want. So it's during these times that we might have a little bit of small talk, or maybe talk about the weather, or they might say, "Mom's not doing well. We don't know what to do, and we're scared." Or, "No, I'm not doing okay. My dog just died." Over the last decade, I've had the privilege of working in several different areas of the healthcare system. For years, I spent time behind the counter, preparing medications at the pharmacy, checking for drug interactions, making sure that the medication you pick up at the window is the right one. The right drug for the right condition, right tablets in the bottle, the right one for your health. In more recent years, I've been working in primary care. So nowadays, my job revolves more around providing education, talking to patients, rather than dealing with medications directly. I see myself as a resource not only for the patients, but also the providers. Sometimes I'll answer questions on why medicine A might be better than medicine B, might try to make sure that those medications that are being prescribed to you at the clinic are actually going to be affordable when you leave the clinic. But over the last decade, what I've learned the most is that most folks just want to be heard. When I go into a patient's room today, I usually introduce myself and say, "Hi, I'm Dr. Elliott. I'm a pharmacist." And then sometimes patients get this sense of nervousness on their face that kind of says, "Oh God, what's the pharmacist doing in here? What did I do wrong?" Which I get, there can be some nerves there. I also understand that I'm not the person they came to see most of the time. I also find that when their doctor's a woman, someone usually makes the comment that I'm not as pretty, or that they don't like my haircut as much. as the last time they saw me. So anyway, after we get through all of the initial awkwardness, I finally get to sit down with them and ask them my favorite question, which is, how are you? Moral of the story is that sometimes the best medicine isn't something that you take. Sometimes it's an ear to listen or a shoulder to cry on. And this kind of medicine is something that we all must start taking. I know I've skipped a few doses over the years of focusing on others, but this is something that we can all provide for one another. Don't make it hard. Just listen. There's nothing more powerful than letting someone be the center of your attention, even if just for a moment. Back when I was working in the pharmacy, I remember getting a phone call one day from a young woman. She was crying. She told me that she had just found out she had diabetes, and she was going to have to give herself shots, and she was terrified. So she comes to the pharmacy to pick up her medications, and I took her into that little room where we usually give the vaccines. I wanted to give her some time to ask questions and maybe provide some encouragement, show her what to do. While we were together, she told me that she had been told she has gestational diabetes, which, in simple terms, is diabetes you find out about while you're pregnant. She then went on to tell me that she was handling this entire pregnancy all on her own. Now it was much more complex and much more scary. So we talked. I showed her what to do. I had her repeat back to me because I wanted to make sure that message was getting through. And you know what she told me helped her the most? I let her cry. A few years later, I had another patient who I worked with mostly over the phone. Hi, how are you? I was originally consulted to talk to this patient about her diabetes, and I very quickly learned that we were going to talk about whatever she wanted to talk about. So that could be what she got at the grocery store, who won the game. She often told me how she refused to stop having her morning coffee, and I told her I had no intention of stopping her from having her morning coffee. But for her, that was a bargaining chip that she could offer to the conversation. Every now and then, I did try to sneak in a little bit of advice. Now, I know your independence is super important to you, and I know that you'd like to keep cleaning out your gutters, but you're 78 years old, so I would really appreciate it if we could find a safer solution. I did not win that argument, but I learned from this patient every time I talked to her. She was always ready and willing to tell me about what was going on in her day, and frankly, I think she enjoyed talking to me. But it was only every now and then that we got to talk about her health. A mantra that I've been trying to live by for the last several years is to seek discomfort, to put myself into situations that spark the fight or flight response and push through anyway. I've been able to meet so many incredible people, go to so many cool places, and most importantly, show myself that I can do it. Last year, I had to move to a new city for a year of training by myself. And I'm so grateful for the bartender at the neighborhood dive bar who came up to me, said hello, asked me how I was. Now, I know for many of us, talking to a stranger can be a very scary task. But when you're the person that needs that ear to listen, wouldn't you want someone to ask you how you're doing? I know I did. There's so much power in just those few simple words of how are you? In a world that's so supposedly connected, I know a lot of people who are feeling very disconnected. Folks that are dying for human interaction. When was the last time you looked someone in the eyes, said, how are you, and actually cared about the response, instead of just trying to make small talk? I believe that checking in on one another may be the greatest tool that we have to combat a disengaged, disconnected, dysfunctional society. And I'm not going to lie to you, it's a hard pill to swallow, to step outside of your comfort zone for the benefit of another person, but we all have to start doing this because we have to be there for each other, for our neighbors, families, friends, patients. I told you all earlier that a lot of the things I learned in pharmacy school were outdated by the time I graduated. But the good news is that this type of method is never outdated. While medications are important, I truly believe that this type of being intentional about asking how others are may be something we can do to truly save lives. So if I were going to prescribe you an easy, once-a-day treatment, I might start you off with a low dose of asking a stranger, "How are you?" Thank you.